So sorry again. Let me go for our presentation. I start with the title of our presentation is Virtual Reality Application for Diagnosis and Treatment of Autism Spectrum Disorder. My name is Ahmadi, Ali Ahmadi, and I'm Associate Professor at KN2C University at Tehran, and now currently adjunct faculty at York University. My specialty is AI, and we are working on different application of AI in different sort of applications. So one of our application is VR, which we just recently started in healthcare and particularly in autism disorder. So let's go to next slide, which is our motivation why we selected autism as a joint research with York University. So autism is very well-known disorder for everybody now, ASD. So in Canada, 1 in 66 kids are engaged, faced with autism, and just in Ontario, 42,000 cases facing with this disease, this disorder. A lot of budget just paid for this disorder, $600 million for just for Ontario government budget, and total $1.4 billion. And that's very big challenge for not only for families, but for government and all the different organizations that engaging in this problem. So what is autism? If I just want to give a short explanation, it's a kind of developmental disorder that affect different scales of patient communication, social interaction, behavior, and sensory processing. And it's called kind of a spectrum because it's experienced differently for every case, every autistic case. So it's like a spectrum. It's not just a specific disorder, specific and fixed level disorder. There are different causes for autism: genetic factor, environmental factor, brain development, neurological factors, many causes. And the problem is that there are kind of interplay between these different factors, which makes it more complicated. So ASD, the autism spectrum, comes in different levels. So the major 3 levels are level 1, 2, and 3. Level 1 is just comes with kind of a difficulty in initiating social interaction for autistic children or autistic patients, and the level 2 is low social interaction and high specific interest. Level 3, which is the highest level and the most hard level, is severe lacking verbal and nonverbal social interaction skills. So these levels need support but the level 3 need the highest support. Level 1 and 2 need some support, some kind of support, not as much as level 3. So in this research, we selected level 1. We address level 1 and level 2 kids. We just focus on autistic children, the children aged between 6 and 14. So what is the virtual reality? Virtual reality is very, I think all of you now about virtual reality. You have maybe some experience working with virtual or using it in different um, application or different needs of your daily life. But if I want to give a short explanation, it's a technology that allows this construction and creation of reality through computer simulation and allows the user to communicate and interact visually and sensually with the created simulated environment in a very immersive and real way. So this simulated environment is designed to give the users a kind of immersed feeling and visual feeling to just interact in a very real sense with environment and with other people. We use some devices and some equipments like glasses, headset, gloves, and clothing to just make this interaction, to just make this simulation more helpful and more real. So you can see here two types of glasses that we use in this project. The right side one is HTC Vive glass headset, which is a very comprehensive tool. Equipment comes with a handset and a navigator sensor. It's very good and powerful tools and give a very powerful a real feeling and very powerful simulation. And it comes with like OS, but I mean the operating system. The left side one is we call it as Gear. It needs kind of a smartphone. We just use it with a smartphone, and all the application is installed in the smartphone and just communicate with the main server. So I like to give some report about the application of VR in medical treatment. So we can see recently there are some research and some good work application of visual reality in medical treatment, in healthcare, in rehabilitation, and specifically in disorder treatment. Disorder treatment, not so many researchers, but recently it's going to just be increased. So the main subject is like phobia, treatment of phobia, obsession, autism, and Alzheimer, and different type of mental disorder. Why people use and why we use VR? What is the main reason that we use this approach of VR in treatment of autism or other mental disorders? The first one is affordable. VR is very affordable in terms of time and cost. And it's you can create accurate and repeatable condition, reusable condition, and give the chance to a patient to repeat and treat the scenarios. And it's good for distance learning, no need to be in person, especially for people with mental disorder. And it gives you the chance to collect and analyze data for other research purposes. There are different methods of treating autism. It's not only for VR, it's a conventional method. So you can see here different therapy like speech therapy, flow time, play therapy, and medication. In this project, I mean the VR-based application, VR-based treatment, it's more likely it's same as similar to play therapy, which means that we with a kind of serious game or serious kind of play to just give the patient the chance to practice some kind of treatment. I like to give some examples of recent application of VR in autism to just give you a perspective and some knowledge about the background of this research. I mean, other works in literature. This one, I mean, by Wales is an interactive virtual reality system for joint attention practice in autistic children. This is a research that the result is published in 2021. They just concentrate on gaze sharing and gaze following for autistic kids, and gave some several options for adaptive interaction. This is a good research, but they are mainly focused on gaze shading. The other one is YJAT is designing a virtual reality-based joint attention task. They just classify 4 modules: task presentation, response presentation, system feedback, and task switching. In the task presentation, they just use virtual environment, virtual-based objects, and virtual characters. It's based on practicing some kind of tasks, and then gathering the response and analyzing the data. For evaluating the autism improvement, not only in VR based approach, just for any kind of treatment, there are some different criteria. In this research, I mean the VRSCT that you can see the reference in the bottom of the slide. They use these kind of measures. It's a good measure for evaluating the improvement of treatment before and after the training. They use this criteria for 30 patients, 30 samples. And another criteria is ASP questionnaire. This is what that we use also in our approaches. This is a kind of sensory, the kind of responses to every sensory experience for people between 11 and 64 years. It's very popular questionnaire, and we use it with 18 questions, and the answering method is just self-report. I mean, the patient give answer and interview with family and clinical observation. This is the sample that we use in our application. This is a sample of questionnaire. We just give this 18 questions to user and ask him or her to just answer by himself or by the family. There's also another research they use. This research also concentrate on gaze, on distraction, on maze. They prepare different situation and just try to follow and evaluate and trace the gaze of the patient. So so far I just gave one very short and fast report about the work in the literature. As you can see, the main works are based on improvement of technical emotion and language abilities, just including learning vocabulary word and verbal ability. But few studies work on potential skills, social skills, improvement of social skills in ASD patients in a multi-user virtual environment. That's what we use in our approach, in our purpose model. This is the main task of our purpose method. We call our model Autistant, which is autism assistant. Uh, this Autistant aim to improve the social skills of VR ASD autistic kids by by placing them in the different situation, different VR simulator situation, and ask them to communicate with different uh, person in the environment. So this autism speeds up the diagnosis and treatment, which is usually very costly and time consuming. These are our learning objective that we follow in our purpose model. By using different scenario, we just aim to uh, improve the collaboration skills, recognizing emotion, self-assertion, decision making, and making friends, developing the relationship. By putting the kids in different situation, different scenario, we just try to increase their uh, skills and just gather the response and feedback to the scenario. So scenarios are the main part of our model. This is very important, the key part of our model, which just designed by discussion with the medical specialists in our team. Is a very important part of our model, uh, which we just designed and implemented by some technical stuff and some medical stuff in our team. So here I just wanted to pass to one of my team colleague, our teammate Hosna. She will explain about scenario and just show some demo about our scenario in this model.
Hello everyone, I am Husna Galandari and thanks to Dr. Ahmadi for his presentation. I will now give some explanations on the implementation of our scenarios. Okay, so our scenarios are implemented in a 3D environment using Unity game engine. And we also use Mixamo library for the animations used for characters. And also our scenarios are designed to be from easy to difficult levels, and based on the reactions of the user, they will be given some scores and they will level up and their score goes higher. Okay, so here you can see that we have 3 different scenarios until now. The first one is the playground scenario. The second one is a classroom scenario, and the third one is inside a bus, a school bus. So based on the score of our users, they're going to be in different locations, and the number of characters are going to vary. Also, we have 2 modes, silent mode and with sound. I'm going to explain them in these slides. Okay, so our first scenario is the playground scenario. And this has 2 major categories, silent and with sound. In each of them, a different scenario is going to be played, and based on the reaction of the user, their score will go higher. So in each of the parts of this scenario, which has 6 parts, the number of characters is going to vary between 1 to 3 characters. So now I will play a demo of this scenario. Okay, I think there's a problem. Oh, no, it's going to be played now. this is the Unity environment, and the scenario is being played now. As you can see, the immersive environment is shown in this video, and this is the mobile application. Okay. Our next scenario was the classroom scenario. But in this scenario, our goal was to see how the user interacts with other classmates. Also, the objects and the dialogues of the characters are implemented based on discussions with medical team. So this is a demo for this scenario. Okay, so our third scenario is the bus scenario. Here you can see the interior and exterior view of this scenario. And here we wanted to see how confident the user is when interacting with characters. It's also important to note that their reactions are saved and later reported to specialists. And this is also the demo for this scenario. Okay, so as the application starts, the user will have to sign in or sign up based on whether they have an account or not. And then they're going to have to put the headset on and choose their scenario. Then the scenario is going to be played, and if they reach threshold score, they can go to the higher level. But if they don't, they will have to replay that scenario. After that, as I mentioned, the heavy movements is going to be recorded, and also their voice and the type of the answer they said is going to be used to draw some graphs so that we can have understanding of the user's responses. Later, they're going to be sent to specialists and therapists to be examined, and that is the end of our VR training experiment. Okay, I will now ask Dr. Ahmadi to continue from here. Okay. Oh, also, this is another demo of our proposed application. This is the whole application. In this part, the user is going to have to sign up, and they have to also say how bad their condition is. This is the menu, and each of the scenarios is going to be played. This is the view which is seen inside the VR headset when the user is having it on. If they reach a minimum score, they will be then go to another scenario. This is the part that there's some explanation about this application. And yeah, I think that's it. Thank you for your attention. Dr. Ahmadi, please continue.
Yeah, thank you, Husna. I'm sorry, my laptop is disconnected from network, so I just continue with the rest of the slides. So this scenario was implemented in VR-based virtual immersive VR and is from the point of view of the patient. So the camera is from the you just see from the view of the patient. So that's for this. That's because we want the patient just try to make communication and practice communication. So we just tested this application on 20 real autistic children. The test period was 6 weeks, 10 tests per patient. So we had 1,200 independent data points. And to just have a qualitative evaluation, we just use the following criteria to check, to verify how much improvement our system had on the autistic patient. These two graphs show how the score point, we just give a score to a player, to patient who is playing the scenario. So if we, as the training steps increase, if we have increase in points, so it means that the patient was able to work in the scenario, just play the scenario, follow the scenario games. So it is a good sign. So if here we have a linear graph, so it's a good sign. And the right side graph, the left side was different steps of one scenario after some training. And the right side is the different repetition of scenarios, one scenario. So it is also shown that by repetition, the patient gets more scores. These two graphs show how change in normal scores for autistic children without learning by VR system and with learning. So as you can see, the right side graph shows that during 7 steps of one scenario, the autistic kids which had training with this VR model, they could be able to have to get a good points, good scores from the scenario, from the game. And this is a very good evaluation. We just try to, because the main issue with patient with autistic patient is that they can the eye contact, the eye concentration. So usually they cannot focus on the uh, target point in each frame of the scenario. So we just try to calculate the difference between the eye focus point and the true focus point in each difference. And we just get this difference as a evaluation of improvement. So in the right side the graph, you see this is before training. We just asked in the first step of training, the kid just have a very difference. There are a difference between the main point and the right point and the kid eye point focus. But after some training and after the last step of VR training, we get a very less difference between these two focus points. So this was what we already done. A short report about this research was done. Now is around more than 2 years that we are working on this model, and we got good result. But we are trying to extend this project, and we plan to increase the number of scenario and variety in animation using more effective tools to input some data from the patient to make better interaction, and also use some physiological data like ECG and EEG, if possible, from the patient. We published the result of first phase of this project in this conference, and this is some other project, VR project, that this team was involved during past years. So as you can see, in different area of VR, not only in healthcare, also in disaster management, in earthquake response, in games, and in learning, e-learning. And this is some picture from the VR lab in York University for ADERSIM program. Thank you, and sorry again for disconnection today.
Thank you very much, Dr. Ahmadi, for the nice presentation. So please feel free to ask the questions in the chat box, or we can open the mic for you. So one question is from the Christian, asking, these graphs are for one participant's training session? So I think
she mean
asking about.
No, this is the average for the average for all 20 kids that we had. We had 20, we tested this on 20 autistic kids. So this is for the average for all the 20 kids.
Okay, so it's like 29 is for the 20 kids on average. Okay, so, okay. So, okay, because I'm just waiting for addressing more questions. So I can ask one questions now that I have is, are you letting the kids going through the simulation together, or they are going through it one by one in each scenario?
No, it's yeah, thank you. It's a very good question. At the moment, we just use it for like personal for one kid, not kind of like multiple or in public place. So, but it's in under supervision of one medical assistant. So they just follow and advise the kid to just use the glass and give the instruction and just get the feedback from his responses to the scenario. And this data is directly transferred to our server. So I mean, basically, the first playing of scenarios are done by one kid under supervision of one medical assistant. But after the kid is treated and just get familiar with the scenario, so she or he can do the scenario by himself. Maybe no need to medical assistant at the home or at other places.
Okay, so one more questions. I'm just looking at the question and answers, so I can ask another question. So, so you have basically you design a nice subsequent or consecutive process, and then when you put the kids on this process, and then at the end, the output and the results would be identifying whether the kids has ADS. These are just my questions. And also, what are the potential maybe treatments for him or her, right, doctor?
Yeah, you know, the medical professional, I mean, the psychologists, for example, say that this kid need to treat this scenario to improve his or her social skills. So we just give this scenario to him, and she or he will try to practice this scenario. The result is collected and transferred to the server, and we just I mean the medical team just identify that this treatment, this practice is enough for his improvement. Because the final goal is how to improve his or her social skills, how to help the patient to focus on the subject in the scenario, how to make interaction with other person, how to make friend, how to in a bus, how to find his or her seat, and how to ask the driver to stop. In the class, how to ask other classmates to uh, to ask the question about the lecture. So these are the skills that she or he needs to learn. And by putting him in these scenarios and practicing these scenarios and collecting the result, the response, and collecting his eye tracking, so the medical professional decide that if the treatment is enough, or she or he need to practice same treatment, or she can go to another scenario. This is the whole story.
Okay, thank you very much. So we have a question from the audience. Hi, thank you for your presentation. I was wondering how much time does it take for each kid to pass these steps? Doesn't it bother the eyes in the long term?
It's very depending to the case. Some within these 20 kids that we tested our system, some kids are very interested in VR technology and very like it's kind of fun for them, and they are very fast in treatment and playing games. But for some kids, maybe it's taking more time. There are some concern that people think that maybe parents think that the VR is not convenient for autistic kids. But in our experience, it was not the case because kids are very happy, not very little kids, kids between 9 and 14, 15. They are very happy with this technology and they use it. And the scenario length is 40 seconds. Basically, it's less than 1 minute. So it's not bothering them. It's not very long play. So just they pass one step and go to the next step. So these scenarios are designed under very strict supervision of medical team. We just created different scenario and recreated and edited. So these scenarios are very, how to say, very medically very strict and supervised by medical team.
Okay, so another comment maybe is Jeff is pointing out that not a question, but more of a suggestion. If the scenarios were more fun, kids would produce higher results and increase the development. Afterward, I worked with 2 boys with autism for 1 year every Sunday. Their grandmother, a doctor and senator, could not believe the changes in both boys, 8 and 10 years old. We engaged in environments that they would not normally see. This enhanced experience helped to improve brain functions and reduce the autistic behavior and ultimately improve their lifestyle. So,
Yeah.
yes.
Yeah, that's a good comment. Yeah.
Okay, so I think if there are no more questions, then we are nearly in the presentation. And okay, so another comment maybe is thank you for your presentation. While the tool seems quite interesting and informative for kids, I was wondering if you have tested and had trials of young people experiencing it. Besides that, has been there any experience with VR training, not just for kids, and what were the ultimate outcome?
Yeah, we need some more scenario for different ages, because this scenario is mainly for little kids. As I told before, it's for 7 years until 12. There are simple scenario, but we are planning to create more 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 various scenario for learning courses in the school, for helping them to learn different courses, different skills. So, and for different ages. Yeah, at the moment, these scenarios are not so fun for any age. Maybe they are very simple for some ages, but they are what the medical team just asked us and supervise. So we are planning for some more scenarios. There is the one I have users. I have VR with kids as young as 2 years old as. Yeah, you know, I really like to talk with this respected participant because we are looking for. I'm very interested to know their feedback with these different ages of autistic patient because our uh, target was only kids between 6, 7 until 12 years old. So if you have some experience with less little kids and like elder patients, so it's very good to just share with us.
Okay, so thank you very much, Dr. Ahmadi and everyone, for joining today's presentation. Maybe we can have some discussion with Jeff if you would like to stay. I can also stay, and Dr. Ahmadi, I'm not sure if he has time, he can also stay. So with that aside, we are wrapping up this session. And so I'm stop recording the session. Thank you, Dr. Ahmadi, again, and everyone.
No problem. Thank you for inviting us and giving this chance to share our results with other participants. And also, sorry again for the disconnection today.